I'm joined now by Dr. Prateek Sharma talking about ASGE's session on the future of advanced endoscopic imaging. Thank you so much for being here.
Thank you, it's a pleasure to be here.
Tell me some of the highlights of this session.
So in this session we are going to focus on what's new and upcoming in endoscopic imaging, okay? We perform endoscopy every day. We use high definition endoscopes right now, and they are the best that we have available, and I think high definition endoscopes are here to stay, and I'd urge everybody who can afford those endoscopes to use higher definition endoscopes. But then we have other advances such as narrowband imaging, blue light imaging, eye scan, optical coherence tomography, volumetric laser, endomicroscopy. So there are a whole slew of technologies out there. So during this session we'll inform everybody what's the current status, what disease states can you use them for, and what does the future hold.
So for physicians who are thinking about making that investment, and you're encouraging them to, how much of a difference does the high definition image make?
So I think the high definition image makes a huge impact. I mean, we've shown several studies now for esophageal cancer, gastric cancer, that if you use these high definition endoscopes, and along with that spend enough time looking at the organ of interest, you will find more lesions, you'll find more dysplasia, you'll find more cancer. So I think by appropriate use of these technologies, you will increase your yield of cancer.
It seems with enhanced technology, obviously it's improving your ability to detect and treat the patients. Where do you see things going and changing, say, in the next year, maybe looking out as far as the next 5 years?
So I think the current status is that you use high definition endoscopes, you use some of these ancillary technologies that I mentioned, whatever you're familiar with, whatever you can get expertise in. I think the key is the right patient, when you can use them, as I mentioned some examples about cancer. Then yourself, which technique do you feel comfortable using? Can you interpret the images appropriately so that you can make an impact on your patient care? So I think that's what I see within this next year, or in the near future, as you mentioned. Looking 5 years ahead, 10 years ahead, I think we will be combining these with what we call molecular imaging. So what that would mean is that it's almost like bioendoscopy, in which you go in with an endoscope and an abnormal area within the gastric lumen will be shining, for example, in very layman terms, and that's the area that you can target biopsy, or that shows an area of cancer. So I think it's an exciting time in endoscopy, and so I hope a lot of you come to our session and you can learn about all the highlights of endoscopic imaging.
That ability to be able to detect cancer better, how is that helping you help your patients?
So the earlier you detect the cancer, the better the outcome for your patients. So as you know, I mean, the outcome is linked to the stage of the cancer. For example, in Japan, early cancer in the stomach is diagnosed routinely. So, now in our hands also we've started seeing, for example, Barrett's cancer, early cancer in colon polyps. We are able to diagnose that early, and then at the same time you can do an endoscopic resection of these cancers. So what you can do is not only detect them but treat them for your patients, so you can avoid surgery, you can avoid the morbidity and mortality which goes along with it. So I think it's a huge advance.
Absolutely. Thank you so much, Doctor.
Okay, thank you, Darren.